Pediatric brain injury and concussion is a major public health problem. In the last couple of decades, we've heard more and more about concussion, but more typically in professional sports or military service members. And despite this increased awareness, there's still tremendous need to understand better how this injury affects long-term brain health in children. UCLA BrainSPORT and the Pediatric Brain Injury Program transcends different departments. We work between neurology, pediatrics, neurosurgery, neuropsychology, and basic science and basic research. And all meet on a weekly basis to share research, to brainstorm new ideas, and to come up with innovative new solutions for the problem of pediatric brain injury.
What makes this group unique is our ability to continually add evidence-based but cutting-edge therapies by working with our research group to find kind of what's next.
We have started from the very beginning trying to change the way the rest of the field in TBI worked in paying attention to pediatrics. There weren't sessions on pediatric TBI back then. And we would go to every conference and, put forth our ideas and push it down people's throats until they would start listening. And now it's a regular thing to see pediatrics being addressed, which is really refreshing.
Our biggest goal is brain health, and we are a big proponent of sports and how that integrates in brain health. We think physical education provides a lot for developing brains and developing kids. And so our goal is to provide comprehensive neurological care for kids, and that involves getting them back to their sports when they have an injury and getting them into sports when they're interested.
In our program here at UCLA, we take care of kids with all severities of injury, including injuries that involve bleeding in the brain or require brain surgery. And those children are taken care of in our pediatric neurocritical care program.
Neurocritical care is the ultimate team sport. When the brain is sore and swollen and the rest of the body may also be injured, you're at risk of what we call secondary brain injury. And in the ICU, what we try to do is prevent that secondary brain injury to give the opportunity for the brain to recover.
Well, the ultimate mission of the BrainSPORT program is to provide care for the community at large. One of the nice side effects of this really great integrated team is our ability to provide really cutting-edge care to elite athletes around the city and around the country. I'm a team physician for UCLA Athletics. We're also the team physicians for the Dodgers, the Lakers, the Sparks, and as team physicians, we work quite collaboratively with our BrainSPORT program. They are involved in concussion care for any of those professional athletes. They help us with our baseline testing and concussion protocols with those leagues, which is really exciting opportunity.
One of the things that we're working on, which is very exciting, is the Care for Kids study. And the goal of the study is to look for why patients will have symptoms longer. We're doing autonomic testing, and then we're also looking at blood biomarkers and imaging modalities to see, are there any clues in any of those tests that we do that can help us figure out or develop an algorithm to know who's going to take longer to recover.
So our researchers look at what we're doing in clinic and try to figure out how they can improve it. And us clinicians talk to our researchers and figure out what the newest and greatest things they're working on and how we can apply that to clinic.
I've learned a lot about how to listen to what our clinicians are seeing. Take those issues back to a laboratory setting and try to design preclinical models. The whole point of our RAFLEET preclinical model was to develop a way for us to address how do athletes specifically respond to traumatic brain injury, and are there things that we can do to help them?
We study things like transcranial Dopplers to see if they're useful for diagnosing concussions and recovery. We're looking at virtual reality to figure out if we can use that to diagnose and rehabilitate our patients. We're always looking at the next device and figuring out what the best thing is for our patients, and we're excited to see what's on the horizon.
One of the other core missions of BrainSPORT is outreach and education. From the education piece, we educate future sports neurologists. So we do have our in-house fellowship program, both for neurologists and neuropsychologists, but we also want to spend time educating the public, right? The patients who are taken care of. The idea of a podcast came up with our goal being really providing great education around mild TBI, but also all this other fun, exciting stuff.
It's part of our central mission to promote safe sports participation. Sports and physical activity are essential to long-term brain plasticity, to normal brain development, and improved socialization. And we want children of all levels and abilities, and even children with developmental challenges, to have the opportunity to participate in safe sports. I'm often asked, what is it about UCLA that makes it special, that keeps me here and keeps us working here so hard together? And I have to say that critical component is the team of people that work together, committed to children's health and children's recovery from brain injury.